Over the last few days, 22 News has been addressing the recognition and treatment of melanoma, the deadliest form of skin cancer. Joining us live to answer your questions about melanoma, we have Baystate Medical Center Surgical Oncologist Dr. Richard Arenas. Dr. Arenas, thank you very much for joining us tonight.
Thank you.
And for helping me out with our series that I did earlier in the week. Tell me first, what are the treatment options for someone with melanoma?
So I think the mainstay of treatment still is surgery, because obviously someone with a melanoma, you think about excising that melanoma. But then a big part of the surgery is actually staging melanoma, which then leads into a host of other type of treatments.
When you say staging, what do you mean?
So melanoma, unfortunately, is one of those skin cancers that can spread or metastasize. And one of the first places that we look for spread of melanoma is to the lymph nodes. So as part of the surgery to remove the melanoma, we also will do a biopsy of a lymph node called a sentinel node biopsy to see if there's been spread of melanoma, because that would then open the door for a potential of other treatments out there, medical treatments that are really becoming more effective to treat melanoma.
Okay, and now we're talking about immunotherapy, right?
That's right.
Tell me what immunotherapy is.
So immunotherapy is actually where you apply or give medications that actually can change the immune system of the patient in a way that it actually will enhance its ability to attack the cancer and eradicate it.
So if you change someone's immune system, then their own immune system will attack the cancer.
Exactly.
That's what we're trying to do.
Right, and if you can effectively change it and leave it to that point where it would stay that way, you can actually effect a cure, even in stages of cancer that you would never think are curable.
Now, you had an example of that as well, did you not? I mean, that everyone seems to know about across the country.
Right.
Our former president.
That's right, because President Carter, Jimmy Carter, actually developed brain metastasis from melanoma. And it turned out that with immunotherapy, even given at his age, he had a complete response and actually has been cured from his melanoma.
I remember when we first heard about that he had brain cancer, that it seemed pretty dire. But that was already years ago, was it not? So he is cured.
Right. And I think that's the whole reason, because when immunotherapy works, it's actually changing your immune system. And if the immune system stays active, and it could stay active for as long as, as far as we can see, it could be for a long period of time, essentially you can keep a patient cancer-free.
All right. Dr. Arenas, thank you very much. We're going to talk a little bit more about immunotherapy in the 6 o'clock half hour. Thank you for joining us. And we will be, again, at 5:30, we'll be speaking with a dermatologist to help you recognize any melanoma that might be on your skin. And if you have any questions that you'd like answered, you can email them to us at report@wwlp.com.